Nick Pahl from the Chief Executive of the Society of Occupational Medicine. Just to sort of double down on the RCN comment around, obviously the much higher death rates. I know this is a look-back question, there's a look forward, but I presume the HSE will be responding to the COVID inquiry. And I suppose just a kind of gut reaction to that and needing to follow up and want to make a comment about that is that much higher death rates amongst health and social care staff on the front line as well as many other key workers during COVID. And I know RIDOR doesn't mean that you can necessarily kind of say they got COVID and died due to the workplace, but you can see the death rates much higher. And I suppose it's those risk assessments that people like Society of Occupational Medicine and RCN helped local teams produce. And I know there was some oversight from HSE, but in terms of the kind of communication and follow through on those risk assessments for health and social care staff during the pandemic, it was, slightly exaggerated, but slightly chaotic. There wasn't really that sort of and I know it's a kind of fast-moving pandemic, but it does concern me about the kind of variation in risk assessments that different NHS social care organisations had in place. Obviously, the lack of capacity on things like occupational health, and there needs to be investment in occupational health to ensure there's capacity to produce those quality risk assessments. So I suppose my question is mainly about the response HSE is going to do for that COVID inquiry, particularly on how risk assessments were developed, and there was regulatory oversight of those risk assessments. Because if there had been better risk assessments and approach and understanding of the hierarchy of controls, with a kind of much more coherent view in terms of PP, which again was fast moving with the evidence coming through, but it didn't feel right. And we haven't had a pandemic since 1918, but I'm sure I would hope you'd feedback on that, because it definitely doesn't feel right on the look back on those risk assessments.
Interesting points. I think the public inquiry will be taking in and structuring itself in the way that it chooses to do, and obviously if we're called to give evidence, we will give evidence. But I think just taking a step back, at the end of the day, the sort of framework of controls in the workplace for health and safety have been known for donkey's years. There's nothing new here in terms of what people are supposed to do in relation to controlling risk generally in the workplace. That hierarchy is well established, particularly through the management regulations. Yeah, COVID comes along, provides a real challenge, could be a public health risk, but obviously quite unique, I would suggest, perhaps in the health and social care sector. Things did move very fast. We were grappling with all sorts of issues across all sorts of sectors. It's not just health and social care, variety of problems. And I think alongside that, we had to get about 2,500 people from being an office-based organisation to functioning from home. And I'm sure all of you had the same challenges for your organisations. So I don't want to dive into too much detail in terms of everything we tried to do around the health and social care sector, but we did, towards the end of 2020, we did an inspection initiative of particularly health trusts across England, Scotland and Wales. Interesting findings. I don't think I want to go through them all, but we did produce a summary report. We actually shared that obviously with the employers and with the trade unions who represent workers in the health and social care sector, and it did bring out some of these issues that you've mentioned in terms of understanding of risk assessment, understanding of the hierarchy of control. But for me, looking forward, I think it raises some big questions around risk management in general within the sort of health and social care sector. And is a bit of a big wake-up call in terms of what's happened, but I think we should build on what's been learned. And certainly it opened a lot of doors to different stakeholders that we hadn't really worked with for some period, or we didn't even know existed, to try and drive change, in terms of improving the way risk is managed in the health and social care sector. It's a big challenge. It's a huge sector. It's a very diverse sector, but I think we've learned a number of lessons. I would hope that the health and social care sector has learned a number of lessons, and we need to drive some of those forward as time goes on. But I can't remember if we put that particular report that we did on our website, but it's certainly been shared anyway with key stakeholders. And it was, I think we visited about 18 or 19 or around about that number, health trusts, and looking at leadership, looking at sort of infection control, looking at PPE. And I think certainly coming back to the PPE debate early on, it was very clear that I don't think a lot of employers in the health services fully appreciated what a PPE program actually involves. It's not just about dishing out things, left, right, and centre. There's a lot more to it than meets the eye. So I don't know if that helps put a few things in context in terms of what went on at that time.
So thank you, Philip. So Lester, have we got some more questions from